might transmitted conditions. So the common approach is anything coming, for example, the presenting complaint could be swelling in the groin, that could be HIV, or the patient would say, doctor, I'm having discharge, doctor, I'm having this. So whatever the complaint would be, so guys, I would like to ask you, you need to use your chat box. So what do you think in any sexually transmitted disease, what presenting complaint you might see? What presenting complaint you might see, guys? Write in the chat box. In STI, what presenting discharge? What else? Pain, the problem down below. Or doctor, I have something like very personal. These are the questions that you might face. And sometimes patient would say, doctor, I have a swelling in my groin, or doctor, I would have this. And when you're doing methods sometime, thank you very much. There are a few of the rash, well done. False swelling discharge, excellent. Catherine itching, right, excellent. Thank you very much. So these are the presenting complaints you might see on these problems. And one important presenting complaint, the patient might say, doctor, I'm having problem down below. When patient male is saying problem down below, there is a lot of things you will be thinking. A testicular problem, you'll be thinking about the erectile dysfunction, or you will be thinking about UTI, you'll be thinking about STI, you'll be thinking of gonorrhea. All those questions will be that would be in your head. So what, let's say there's one presenting complaint, anything, please tell me more about. Or if it's a second visit, you would say recap of previous visit. Can you please give me a quick recap? When last time you came, what was the symptoms? What were the symptoms? What was the investigations done? For example, in STI, most of the scenarios, the patient might be positive for gonorrhea or HIV or maybe something like that. How would you deal with such situations if someone is coming with that? What was the investigation was performed? Which blood test was done? What was blood test done? How and when? How long you had these presenting complaint? And what is your sexual health? May I ask you a question about your sexual health? Change over time, anything make it worse or better? Might be giving you linear rash, discharge, offer confidentiality as soon as possible in any of the presenting complaint. So again, whenever what the examiner wants from you, they want from you that you are a safe doctor. They want from you that you are a safe doctor. When you start, always start with red flags. For example, if someone is coming with any lumps and bumps or something like that, you will ask about fever, any flu-like symptom, any recent weight loss, and lumps and bumps. Thank you very much, Anam. Right. And any problem with the opening your bowel, loose motions, that is related to HIV, opening bowel, and do you have any urinary symptom, lower urinary tract symptom like burning pain while passing wee, or anything, any discharge have you noticed from your private part? Then you will ask about rash, bleed, discharge, signpost, few standard questions about your sexual health. That what do you have a stable partner? Do you have a male partner or female partner? Any other partner you have? Then you will ask about sexual preferences. Do you do protected sex? Do you do oral, anal, or do you use STIs? Ask those questions. Have you ever had a prophylaxis for HIV? Have you ever screened for STI? Did you have a receptive sex, or do you not have? Do you know your partners? Ask those questions because I told you, always think of partner in sexually transmitted diseases. Confidentiality, partner, STI, and gun clinic should be in your head all the time. Okay, Mactosa, signpost, thinking about your general health. Do you not have any non-allergies? And then ask about do you not have any problem, similar problem, or any sexually transmitted? These questions. Related to that, recreational drugs. Again, don't forget, guys, recreational drug. Travel, ask whenever you are going to see a male who say, I went to holiday, who says, I'm a businessman. Do you always ask, do you have a travel? In most of the scenario, they would tell you, I traveled to Thailand and I had a sex. I'm afraid my wife will get to know about that. These are the issues you will see that some confidentiality is casual sex, always ask. If someone say, I was in the Thailand, then don't be judgmental. Don't say what he was doing there. Don't say like that. You say, okay, can you please, may I know what type of business meeting it was? Or it was a holiday. Yes, it was holiday. By any chance, and did you had any casual sex there? You can ask. They might tell you there. Then ask about thinking about your lifestyle. If you need to ask about diet, exercise, smoke, alcohol, or anything, you could ask. Communication tools you will be using. Have you given a thought that what could be the cause? Always consider eyes. What is your biggest worry at this point? Are you specifically expecting anything today from my side to that I could help you? Always ask. Then observation, do that. Always mention chaperone in the private. I would like to maintain your privacy. You need to mention about chaperone. Okay, explain. It's a sexually transmitted disease, whatever it is, caused by this bug, and don't worry, I'm here to help you. And management, in most of the management with the STI, you would say, I would like to refer you to the gum clinic. I will give you information about the gum clinic. Gum clinic is genitourinary clinic. They would do what? Offer them STI screen. Always offer them STI screening. Advise, inform partner. Do not agree. That if they do not agree, then tell them there is another way to give you a notification to your partner, in which we will just send a letter to your partner. We'll not inform anything about your sexual problem, but we'll tell them they need to get screening for your sexual for the STI. So your partner might need to come. Explain and answer patient concerns. By any chance, my partner cheating on me, how to answer those concerns. Then I will come to that when we'll be doing that. Like, I can't, you have to explain that in different scenarios. Is my partner cheating on me? How long? Complications of medication, antiviral if needed. You will explain all those things. So again, guys, I will be taking a sexual history now. And again, before I proceed, I want all of you to write, all of you doctors, I want to ask one question before I proceed further. You can use your chat box. Dr. Kerman, I highly appreciate you using you're taking this session again and again. Well done. Can you please write in the chat box what things you will not miss if someone you are suspecting sexual history? So I'm going to type in the chat box, and I would highly love that you will write all those 7 point or 6 point which you not